Okay, well, I'll continue. I thought we might have had some technical difficulties. Who, hmm, I am not on mute. Okay. So yes, we have the third annual Pennsylvania Black Health Matters Conference starting on April 15th with a kickoff event in Vernon Park in the Germantown area of Philly, and it ends on April 18th with a full day of online virtual forums. Um, this year's theme is Living Her Best Life. So, as the name suggests, we're focusing on the health and wellness of women this year. So, be sure to stick around to the end of the show to hear more details. But what makes this show so special is that we have invited several guests who are going to be part of the health conference, and they will share some highlights on important topics and activities that will take place during this 4 day long event. Today's guests for our Speak On It segment include Dr. Annette Garabeku of Drexel University School of Medicine, who is an associate professor and chief of Drexel's Division of Community Health in the Department of Family, Community, and Preventive Medicine. She's also an associate dean within the newly formed Office of Community Health and Health Equity. Lakeisha Garland will also be joining today's episode. She's the director of the Family Practice and Counseling Network. Next up, we'll have Tracy Thorpe Scott, the principal consultant and strategist of TTS Coaching and Development. TTS takes a holistic approach with individuals and organizations to create positive and sustainable transformations. And we'll close out the day with our Make Moves segment, joined by Tanisha Wilson, Master of Education, Temple University Program Coordinator. She's going to discuss the importance of diverse engagement in schools and share some of the diverse performances scheduled at the April 15th Health Festival. So, as we always do, let's get our minds right and start today's episode with our first segment, Let's Get Lifted. And, we may kind of go a little bit deep today because April is National Minority Health Month. And according to the National Institutes of Health, National Minority Health Month is dedicated to raising awareness about health disparities that continue to affect people from racial and ethnic minority groups in America, and encouraging action through health education, early detection, and control of disease complications. At first I had to kind of level set because sometimes I have an issue with the term minority because we have to be very specific. We're talking about here in the United States, because we as people of color, we may be the minority here, but across the earth, we should keep it in context that we're not in the minority if we think about the global community. So we're talking about the specific issues that affect our health as minorities here in the United States. And research has shown that racism, discrimination, and unconscious bias continue to plague the healthcare system and cause unequal treatment. This research is consistent across the nation, and of course that translates here to Pennsylvania as well. Black patients in particular have had complaints and symptoms dismissed, which can lead to delayed diagnosis, pain undertreated, and often are referred less frequently for specialty care when they may need it. Many older Black Americans can still recall times when some areas of the country had segregated clinics and hospitals and grossly unethical medical abuses and failures and experimentation, such as the infamous 40-year-long Tuskegee syphilis experiment. And here in Philadelphia, we have to also reflect on the studies that were done amongst prisoners in Holmesburg Prison. If you haven't gotten the book Acres of Skin, it's definitely something worth spending time on. But every April, the U.S. Department of Health and Human Services, Office of Minority Health, observes this month to highlight the importance of improving the health of racial and ethnic minorities and reducing health disparities. So this year, the theme is Better Health Through Better Understanding. And speaking as a Black physician, I'm passionate about increased representation in healthcare so that we can at least have the number of physicians, nurses, and other health professionals that reflect our population. But many of those efforts can take years to produce. So it is essential that we build awareness and understanding amongst all health professionals so that we can reduce the negative effects that systemic racism can have on our health. And of course, mere acknowledgement of these issues is not going to fix things. There needs to be deliberate, intentional action as well as assessment of the results of any actions that are taken to make sure we don't throw good money after bad if we try something and it isn't working. And of course, we have to educate health professionals, other staff, hospital administrators. That's an important step. And being willing to call out microaggressions and overtly racial aggression is essential. And it may take some advanced preparation on a part of the patient or the person going through that experience to be able to do this effectively. Because when these incidents occur, they can be difficult to document or prove. And, when we don't know what to do in a moment and we let time pass, if you circle back to it, many times people's version of events starts to differ, and it can make it easy for people to be entrenched in continuing the behavior they're already doing because they feel like they didn't do anything wrong and they don't need to change. But when you're on the receiving end of that, trying to prove you've been mistreated puts the onus on the wrong party. But addressing problems in the healthcare system, of course, it's only one end of a two-way street because on one end is the system, on the other end is us as individuals and our community. So we really do want to make sure that we educate ourselves to understand our rights and push back when we need to in order to get the care we need and deserve. For instance, there's nothing wrong with changing physicians. I've even suggested this to some of my patients. If they obviously didn't feel comfortable with my style or medical advice, you can call your insurance company, get a list of other people in your network, or consider even signing up for a doctor that's outside of your network. We tend to think in terms of like our insurance those are hard, fast boundaries, but sometimes you may decide to go outside of that network and invest in someone who may be a better fit for your needs. You can get a second opinion. If you have a condition, especially I encourage patients to do this if it's complex, you can get another opinion and see if, you're getting consistent advice from different people, or if you just feel more comfortable with another healthcare professional. And even if you're in a hospital setting or hospital-based setting, there are often ombudsmen who are supposed to advocate for patients. They may call them a patient advocate. And those people who need additional support or are having trouble navigating, you can reach out to those people and that service to get some extra support. So, okay, brothers and sisters, as a doctor, I'm Dr. Shabazz, and I know there's more that we can always do to be accountable for our own health and wellness. And if you have a doctor that you trust and you agree to a treatment plan, please do your part. Follow, if it's a new diet that's been suggested, follow that. If, you're going to need medications, whether that's temporary or long-term, please follow the plan or be forthcoming if you're not following it, because there are a lot of chronic diseases that we can manage better, like diabetes and hypertension, if we have consistent positive lifestyle choices. So we want to make the most of those, but sometimes it does require some extra steps, whether that's medication or other types of intervention. So we owe it to ourselves to be consistent. Consistency is key because the overall goal should be for everyone to have access to unbiased, equitable, high quality care that's delivered in a culturally thoughtful way. And that's why it's important that we have platforms like WURD and organizations that are consistently pushing back and empowering our community, such as the Pennsylvania Black Health Matters Conference. It not only brings attention and offers solutions to the inequities that exist, but it also arms us with the information we need to be better advocates for ourselves and our communities. We're going to learn about what's going on with current health policy, have forums that provide information about prevention and treatment for the everyday person. And the upcoming health conference is going to provide a safe space for us to hear from health professionals, physicians, and other practitioners, and we can engage with each other. So let's find out more about this awesome free conference that was made for us, by us, and dive right into the Speak On It segment. Now, I want to make sure you're all keeping in mind that you're going to hear a lot of discussion around health and wellness, and you need this information, but I don't want you to consider any of this information as medical advice. Guests on the show provide valuable information, but please consult with your own physician or other healthcare practitioner before making any changes to your healthcare regimen. Don't wait until you have an emergency or something has fallen off before you think about establishing that relationship. Get one now, even if you're healthy, because when you do need medical help, you want to have someone who actually knows you and can be a partner in what course of treatment is best for you. Because I'm a licensed doctor, but I am not your doctor. Some of my patients may be listening, but in general, for most of you, I'm not your doctor. So be sure to follow up with your own health professional to manage your specific health concerns. You're tuned in to Her Health Matters radio show. I'm your host, Dr. Sophia Shabazz, and we're on WURD Radio. Again, we're airing on 96.1 FM, 900 AM, and we're streaming on WURD TV. To our listening audience, this is a live show today. Please call us at 215-634-8065 or toll free at 866-361-0900. If you have questions for any of our guests, call in and let's make this a conversation. So we're going to move right into our Speak On It segment and welcome our first guest, Tracy Thorpe Scott. She's the principal consultant and strategist of TTS Coaching and Development. TTS creates positive and sustainable transformations with a holistic approach. Prior to starting her own coaching and consulting firm in 2016, Tracy held sales and marketing positions at prominent Fortune 500 companies, including Philip Morris USA, PepsiCo, and Procter & Gamble. She also served as the Community Relations Director for a large senior living community in the Pittsburgh metro area. Tracy's dedication to personal and professional development led her to obtain a master's degree. As a certified life coach and a clinical hypnotherapist, Tracy combines her educational background with her BS in marketing and MBA from Indiana University of Pennsylvania to provide unparalleled insights into achieving success. On behalf of the Her Health Matters radio show family, I'd like to welcome you to the show, Tracy.
Thank you. Thank you so much. So glad to be here.
Thanks so much for joining us. We appreciate you for joining us from the west side of the state, Steel City, Pittsburgh, and you're doing remarkable work out there. Can you tell us a little bit more about TTS Coaching Development and how you got started?
Well, I am born and raised in Philadelphia, so I am a transplant to Pittsburgh, but I started TTS Coaching and Development because I want to say back in 2009, I started coaching cheerleading, and I noticed how many of our young girls were deficient in self esteem and self worth. And so while I was able to instill some self esteem, self worth concepts with them through cheerleading, it was an easy pull. I brought them in with the sport and I was able to convince them how important loving themselves was through the work that we did in cheerleading. I wanted to expand upon that. And so I developed a program that I call I Rise Confidence and Leadership Workshop. And it is really a curriculum that seeks to help young people do a deep dive in understanding who they are and what they bring to this world and the difference that they can make.
That's amazing. And when you're doing that work, what do you think what's become the biggest concern that you've identified when you're working with our young Black girls?
I think it's twofold. The first is family. Uh, their home environment has a huge impact on how these young ladies perceive themselves. If they are not being supported, encouraged, inspired, uplifted at home, that translates into who they hook up with when they're in school, the friendships that they choose, um, and the belief that they have in themselves, in their ability to succeed in this world. So that's the first plank, family. And the second plank for me that has the biggest influence is peers and social media. These young people are exposed to so much more information than we ever were,
Right.
and they are struggling to process it and find how they fit into this grand picture. When I was growing up in Philadelphia, I only had to think about the kids who were on my block or who I went to school with and what they were doing. These kids see the world at their fingertips. And for young ladies in particular, the messages that they are receiving about how they have to be, who they have to be, are not always positive and or inspiring.
Right. That kind of is a great segue to the discuss the very serious forum that you're going to be a part of on April 18th, the hypersexualization of Black girls in America. Can you give us a little snippet of your thoughts on that topic? You kind of touched on or alluded to it, but the audience can tune in on April 18th at 6 p.m. to really hear you address that topic in depth. But if you could just give us a little snippet on the topic.
Well, uh, because I don't know what physiologically allows that to happen. You probably could speak to that a little bit more than I could. But oftentimes, our girls develop physically a little bit faster than some of their peers, girls of other races or ethnicities. And because of that, they are perceived as being sexual when they're not. They're perceived to have a knowledge and understanding of an adultification that they do not. Sometimes is that they're taller, they are physically more woman-like, and they are absolutely treated differently. In response, I think our girls are quick verbally, right? In defense, in self-defense, because as a child, that's the only thing you have to defend yourself. And so, as they are trying to develop into who they are as a person, there are all of these factors outside of them trying to tell them who they are as a person. And
Right.
it is a very confusing and sometimes a depressing time for our young girls.
Right. Well, I'm grateful for all that you are doing um, to help to fill that void and to have an impact with our girls. And hopefully you'll be able to stick around for a bit as we proceed with today's show. Again, I want to remind the audience, you can feel free to call in with any comments or questions you have for Tracy on or any of our other guests at 215-634-8065 or toll free 1-866-361-0900. Again, you can hear more from Tracy on the topic of the hypersexualization of Black girls in America. Go to blackhealthpa.org to register for the online talk. So next on the Speak On It segment is Dr. Annette Gadabeku, MD. Dr. Gadabeku is the Associate Dean of Community Health at Drexel University College of Medicine. In this role, she works to establish local partnerships to promote urban health equity in collaboration with the university. Dr. Gadabeku is an associate professor in the Department of Family, Community, and Preventive Medicine and chief of the Division of Community Health. She received her bachelor's degree in biology from Brown University, obtained her medical degree from Temple University School of Medicine, and completed her family medicine residency training at Thomas Jefferson University Hospital. Her academic interests include urban and underserved community medicine, adolescent medicine, women's health, and global health. So welcome to the show. First, I want to make sure I got your name right.
Yes, you did. Thank you.
Okay, got it. Sophia Shabazz often has to make minor adjustments, so I want to make sure I got it right. So welcome.
Thank you.
So you're the chief of the Division of Community Health. Can you tell us a little bit more about exactly what that department is and why its existence is important?
Yes, so community health has just been a passion of mine since I can remember starting and being into family medicine and starting family medicine residency. And to me, community health means meeting people where they are. We want to make communities as well as individuals healthy. It starts with the individual, but it also filters into the communities at large, whether it's neighborhoods, whether it's the communities where people live, where they play, where they serve, where they worship, wherever it is they are. And that's really about what this is meeting people where they are. You all have already kind of touched on some issues related to our communities that hinder us from extending ourselves into the health field and feeling some mistrust and hesitancy. And as much as we encourage people to come to the doctor, go to the hospital, get taken care of, people just don't. And I just really am passionate about going to where people are and providing whatever I can for them in terms of their health, whether it's information, education, services. And as an academician as well as a clinician, I really love teaching about it and teaching our future providers to do this, how to do this work, and how to do it appropriately. So that is the basis and the foundation of developing the community health division and actually having a new Office of Community Health and Health Equity in the College of Medicine. And as you know, we are being more aware of this issue of community health and health equity. I'm proud that our institution at Drexel has made that a fourth mission in their College of Medicine. So adding to clinical service, adding to education, adding to research, we're actually adding community engagement, and that is why my role now exists as Associate Dean of Community Health at Drexel University.
So can you tell us about some of the programs and how would someone in the community access those programs?
Sure. So many of the programs that we do are just, based on actually requests from the community and community sites and services or churches or community-based organizations that want to have health screening events or health information events. So a lot of this came out of just being requested, hey, can you come out and do some screenings? Can you come out and do some education? Can you do some health chats? You know, during COVID, as we were more virtual, we were able to do that on Zoom. So a lot of the things that we do, particularly as the weather gets warmer, we'll be out in the communities and doing some community health events in the neighborhoods. I also, in my role at Drexel, oversee some of our student-led and student-engaged clinics and programs. And so we have multiple, we actually have 6 clinics in total and 10 educational health programs throughout the city. And they're based at community-based organizations. For example, we have a clinic at Eliza Shirley, which is now a family shelter downtown. We have one at the Salvation Army Drug and Alcohol Rehabilitation Center in Roxborough. We have one at the Family Life Center, which is also in West Philly. That's another shelter. So we have a few clinics that we go to on a weekly basis with students and residents and provide care on site for people who use those services. We also have these educational programs where we try to partner with some of the established partnerships we have with communities. For example, our most popular one right now is called the Microgreens Outreach Team. And we have students that go out and do educational workshops on how to grow your own microgreens in the cover of your own home.
Medical students?
Mm-hmm.
Oh, wow, that's awesome.
Yes, and they do workshops and sessions and teach you how to do it. And we actually have been doing this for about 1.5 years. We partnered with one of the schools, St. James, the middle school in Philly, and some of their community members have been growing their microgreens for almost 1 year now, and they use them in their little recipes. We partnered with our food lab to create some recipes that we have people make. So different programs like that. We have smoking cessation, Narcan outreach. So I really enjoy just working with the students and bringing our family medicine residents along and really providing these programs for people throughout the city.
One thing that comes through, I'm looking at your necklace and the heart of medicine. It definitely comes through, and even your whole persona, and you're obviously very excited about the work that you guys are doing, and I thank you for it. And we know Drexel is representing in a big way with this year's conference. So why don't you tell us a little bit about some of the information that you're going to be providing at the Health in Action Festival on April 15th, and a little bit about the virtual panel discussion that you'll be part of on April 18th.
Sure. So for the Health in Action events, that's going to be, I think, in Vernon Park outside. Yeah. We got some of our student groups to represent at the health fair. And so our microgreens team will be out there and they'll do a little demonstration. We also have our Narcan outreach team that will be there, and they will be giving information on substance use disorder, how to recognize opioid overdose, and even do a demonstration on reversal with Narcan. We'll have some of our smoking cessation program, education information there. We'll have, I think, some screenings and other general health information on how to stay healthy, how to be healthy.
You guys are going to be working, basically.
Yeah, so I have a lot of people coming with me. We have a whole team that will
the cavalry is coming.
Yes, we'll be out there. We'll be definitely out there.
Thank you so much. I know, it sounds like you have so much that you're doing, and so much that you're bringing with you to the conference and the Health in Action Day, that we couldn't get to it all, but you could go to blackhealthpa.org for any of us who want to find out more information about it. I am Dr. Sophia Shabazz, the host of the Her Health Matters radio show. We're on 96.1 FM, 900 AM. And of course, if you want to see bright, shining faces of my guests and mine, and you could see Dr. Gadabeku's heart. I guess I look at it and I think the heart of medicine. You can catch us live streaming right now on WURDTV.com. We have a packed lineup, so we're going to bring on our next guest and start our health policy segment. But if you're able to stay on, Dr. Gadabeku, we welcome you to stay on. Feel free to jump in the conversation, or if there are callers who might have a question for you, you can hang out to answer. And just to remind our listeners, 215-634-8065 or toll free 866-361-0900 with any questions or comments for today's guest. So we have next the Director of Development and Social Innovation at the Family Practice and Counseling Network, Lakeisha Garland. She's joining us now to start our segment, Policy and Women. The Family Practice and Counseling Network is a network of federally qualified community health centers that uses an integrated nurse-managed model to deliver primary care, behavioral health, dental, and preventive services. Primary care at the network is provided by nurse practitioners with advanced practice degrees to diagnose illness and prescribe medication, make referrals to specialists, and help patients manage chronic illnesses, provide pre- and postnatal care, and to offer a wide variety of other primary health care services. So welcome to the Her Health Matters radio show, Lakeisha. It's a pleasure to meet you.
Thank you, Dr. Shabazz, for having me. It's wonderful to meet you as well.
And why don't you tell us a little bit about your background and how you became involved with the Family Practice Counseling Network?
Sure. So throughout my career in public health, I've worked in a few industries and health systems. Over at Penn as quality coordinator for quality improvement efforts, doing a lot, around the chronic care initiative where internal medicine practices, embodied, NCQA policies and strategies to transform their practices in order to, meet needs of patients, through social determinants of healthcare, ensuring that there's adequate access, and really meeting needs for high-risk patients. And so, throughout that tenure, I was able to connect with Family Practice and Counseling Network because for the first time, they really got it. I've been a fan of FPCN for so long, and so this is just a dream to be able to serve, along with them. I've been with the network for about 8 years now. And so, really meeting needs for, vulnerable communities, through integrative health care. It's one thing to talk about the physical attributes of what it means to be healthy, but we know that in order for us to be healthy, it's more of a holistic approach. And so thinking about health in not only the physical, but also, mental, emotional, and spiritual health as well. And so, at Family Practice and Counseling Network, that is absolutely a mission of ours to be able to provide comprehensive, compassionate, integrative health services for folks' mind, body, and spirit.
And so would you say that's how you define integrated healthcare? Because some people, they might like, I thought we, were done with integration years ago. It might need a little bit more, clarification, but it sounded like you kind of gave that definition where you're looking at mind, body, soul, all of that.
Absolutely. Absolutely. And, at Family Practice and Counseling Network, we not only provide primary health care services, but behavioral health care services, also dental health services, and everything else in between to meet social determinants of health. So by ways of, our social work team, our outreach and enrollment team to help folks, get insurance to be able to hopefully improve quality of life, fitness, mind, body, nutrition. There's so many other services in between, our prenatal health care services. It really runs the gamut. And, and that's it's something that is just a work in progress. There's always an opportunity to improve and to embark on innovative healthcare approaches. And so I'm really, really proud to also be a part of the Family Health and Birthing Center project.
Right. I was going to ask you about that.
Yes. And that's been, oh my gosh, that's been about a 7-year conversation. And it's so great to be able to see the light at the end of the tunnel, because I got to tell you, it's not easy to, first of all, just embark on something like that in the city of Philadelphia in the ways that, we're looking to do. Lots of, hoops and hurdles, but we're almost there.
So what exactly is a birth center, though?
Right. So a birthing center is a place to give birth that is not in a traditional hospital. And, it's something that provides a home-like feel. For us, we really, as you've stated before, we are a nurse-managed facility, and so we'd like to continue on with that tradition here as well. And so by use of providers such as midwives, but also infusing in beautiful supports like doulas and nurses to be able to help birthing parents really embark on what it means to have a centralized approach to their birthing journeys. As we know here in the city of Philadelphia, in the U.S. at large, in terms of what it means for maternal health, specifically for Black women and Black birthing parents, we're dying at 3 to 4 times the rate of our white women counterparts. And so, this is a crisis. Here in the city of Philadelphia, where Black women and birthing parents only accounted for 43% of births, it accounted for 73% of pregnancy-related deaths. And so, when we think about, a startling outcome like that, that is absolutely a crisis. And here in the U.S., where we're having the highest expenditure for healthcare, it's absolutely ridiculous, and we've got to do something about it. Family Practice and Counseling Network, we're embarking on this mission, as a community, as one community solution, not the solution. And, we give reverence, to all of our birth workers who are out here, in the trenches doing this work, who have been doing this work on a grassroots and a systemic level. We know that systemic racism absolutely plays into part, for what it means for the experience of Black and brown people, specifically Black and brown women. We think about the maternal health crisis, and it's not getting any better. It's not.
Right. And when you learn that while many of our health concerns and issues and the disparities around them have to do with economics, money can't protect you.
It can't. And that's
money can't protect you.
That's right. That's something that we know, and what we find in the women in the circles and the people that we've talked to your point, it doesn't matter. I've leveraged my own experience, as a mother, my own birthing experience where I almost died. And it wasn't really until I began to do this work where I realized that my mother was the compliance officer of said facility where I gave birth. And I came this close. I had to have a massive blood transfusion. And so I'm just so thankful. So the mission is very personal to me. It's bittersweet. When we think about, those who we've lost, preventable deaths, we need to do something about it. And so, this is why, we're embarking on this mission.
Could you give our audience information about how they could learn more about the Family Practice and Counseling Network? Do they need insurance? Do you have, some type of sliding scale or other way of paying? I know you mentioned about people to help you get signed up with insurance.
Right. So we are what's considered a community health center. We're a safety net health center. And so we do not turn anyone away regardless of the ability to pay. Our guiding principle is that quality health care is a right and not a privilege. And so, we open up our doors. We can offer a sliding scale fee. We absolutely accept insurance. But if you do not have insurance, we will help you get some. And for those who may be, in immigrant status or uninsurable, we will work. Our teams will work to make sure that you are getting the adequate health care that you need.
Right.
And so,
That's going to be a perfect segue into what I was going to mention next. But first, I wanted to make sure that you have the opportunity to tell us a little bit about how your organization is going to be involved in the Health Festival on April 15th in
yes.
Vernon Park, and also the online forums on April 18th.
Absolutely. So we are so excited and thrilled to be a part of this wonderful, magical day to serve the community. So our teams will be out doing live health insurance enrollment. We'll also have our health resource teams that are out there giving out health literacy education and resources to the community. So we're really, really excited. Thank you so much, Dr. Shabazz, for the opportunity.
Thanks again for participating and for sharing the good news, even though it can be bittersweet at times, about all the great work that you're doing. And before we close out the policy segment, we're going to, kind of dovetail right along in terms of policy issues that's going to affect many people's SNAP and Medicaid benefits. This month, SNAP recipients went back to receiving one payment. That means that almost 2 million people in Pennsylvania will see their monthly payments shrink by an average of $181 a month, according to the Department of Human Services. And I believe starting April 1st, people will need to resume re-enrolling in Medicaid annually like they had prior to COVID. So, many people may have gotten a packet in the mail or other types of communication. If many of my patients I know who have Medicaid, they may kind of have their mail going one place, but they may be staying somewhere else. Please, it's so important to make sure you keep your health benefits running continually by re-enrolling. So that's going to start on April 1st. Again, we just heard Lakeisha tell us that they're going to be at the Health and Action Day on April 15th, helping people get re-enrolled, because by April 15th, if you hadn't done it, you're going to need to re-enroll because you will be kicked out at that point if you don't take care of it this week. But DHS estimates that roughly 618,000 people will lose their Medicaid coverage because they no longer qualify for the program. And also, many people are unaware that they're going to need to be reapplying, like we said. So this could turn into a crisis that too many people aren't fully aware of if you're in the middle of a treatment plan and things get interrupted. So Community Hero is going to have organizations like this out at the festival in Vernon Park with their laptops and Wi-Fi, helping people recertify or re-enroll. So if you have questions and need help with recertification, come out to Vernon Park at 5800 Germantown Avenue in Philly for assistance. Of course, we recommend you also contact your case manager immediately, because these changes, it's going to happen on April 1st. So by April 15th, there's already going to be a 2-week delay. So you have some active issues, especially, please don't wait until the 15th. But if you haven't figured it out by the 15th, then we're going to have a team out there to help you. So now it's time to make moves. This is our last segment in which we're going to share some key events and activities in the community that will keep you moving and engaged in your health and wellness after this show is over. So let's bring on our final guest. Do we have her? We're looking for Miss Tanisha Wilson. Is she connected? I don't know if we have her. Okay, so hopefully she'll be able to join us and really tell us a little bit more about the work that she is doing. We're going to have a lot of things, a lot of activities that are associated with the Health and Action Day on April 15th. In addition to some of the acts that Tanisha's involved with, there's an entertainment company by the name of Key Productions that will be providing a live singing and innovative multimedia performance. There will be singers, artists, a DJ, an African drumming troupe, hip-hop exercise sessions, yoga in our highly anticipated Wusa area, We all need a woosah moment and so much more. For the children, we're going to have a lineup of entertainment, including a magician and clown and a super fun kids zone. And the Black Church Food Security Network is hosting a pop-up farmers market with food sourced directly from Black farmers and a seed bank. So we heard from Dr. Gadabeku about the microgreens team. They're going to be there, Black farmers, seed bank. We've got so many activities. There's going to be a henna painter, other creative artists on hand, and importantly, healthcare services such as blood pressure and glucose checks provided by the Philadelphia College of Osteopathic Medicine. Giant Pharmacy is going to be providing vaccines. Salus University will be providing eye exams, and there's just going to be a boatload of health-related resources. The goal is to connect individuals with services and information that they might not have ready access to. So just some other, things. Maybe not completely sugar compliant, but we'll have food, delicious Sadiq's all natural water rice. You can't be from Philly and have a Philly event in the warmer weather without water rice. So we're going to have that. The Philly Defenders are going to be out there hosting an expungement clinic. They can only provide services. This is something important because, it's the Pennsylvania Black Health Matters Conference, but they can only provide services to people who live in Philly. But they may be able to provide contact information for resources for people to connect to who may be in other counties. So obviously there's too numerous to count amount of programming that is going to be available for the low price of $3.99. You can check it all out at blackhealthpa.org. Again, the festival is going to be taking place Saturday, April 15th at Vernon Park, 5800 Germantown Avenue in Philly. I hope to see you there. I'm going to be there too. So please be sure to find me. Tell me what you think of the new show. There's no registration required for the in-person festival, but remember this is a hybrid in-person and virtual conference. There is registration required for the online forums on April 18th. Note that registrations completed by April 7th, that's coming up soon, are going to be entered into a raffle to win a $50 Visa gift card. So yeah, you want to make sure you're getting registered today. Set a reminder in your phone right now. If you, for some strange reason, you can't do it right now. We had last month, Dr. Deborah Crabb, and we want to make sure that we let you know about her Twitter chat she's going to be leading on April 30th at 1 p.m., where Dr. Crabb is going to lead a virtual conversation about heart disease and women of color. She's also going to be a panelist on the Health Conference Forum Connection between Oral Health and Heart Health on the 18th. So that's, we've got so much going on. And lastly, as part of Community Hero Action Group's ongoing Building the Block initiative, we encourage everyone to be informed and engage. And that includes voting every 6 months. We have a primary and a general election every 6 months. There's lots of different ideologies from different candidates, lots of candidates. Many of these issues and some of their platforms could directly affect women's health and wellness. So we know that during this show, we've discussed a number of health-related topics that are detrimental to the health and wellness of Black people and Black women in particular. It's critically important that we have public officials who are going to take our issues seriously and create laws and policies to address our issues. So do your research, vote in your best interests. We have judicial, municipal, and mayoral races coming up. Once you start seeing all the advertisement, it's coming. The next election is a primary being held on May 16th. Visit votespa.gov for more information to register to vote. And if you're already registered, check your voter registration status. Candidates running for office in Philly. Oh, okay, awesome. Candidates running for office in Philly have been invited to the festival. It's going to be interesting to see who shows up to meet the community where they are. We're going to have a voting area with kiosks that you can get online and check your registration status, register to vote, or order your mail-in ballot if you need it. So we do actually have our last guest on the line. And let's bring on Miss Tanisha Wilson. She's demonstrated a history of working in the education management industry. She's skilled in educational leadership, fitness training, bilingual communication. She is fluent in Spanish and English. She has a bachelor's degree from Temple University and a master's degree in advocacy and organizational development. So Tanisha, welcome to the show.
Hello, hello. How are you?
We're doing great. Why don't you tell us more about the department that you work in at Temple, and tell us how Temple makes sure there's diverse outreach and inclusivity when it comes to student engagement.
Absolutely. So I work in the Division of Student Affairs. More specifically, I work in student activities. My role, I run leadership development for our students and staff, and I also run our service immersion program. This is a new part of student activities, so I'm very excited to be the first program coordinator to do leadership and service inside of this space that a lot of our student organizations operate in. When it comes to diversity, equity, and inclusion, in my obligations, I run our Inclusive Leadership Conference. So last month, we were able to bring in over 200 students to learn about leadership, diversity, wellness, inclusion, and all of those things that help them as servant leaders and student leaders inside of their environments. And then Temple also does a really great job with diversity advancement with our Ideal office that we partner a lot with in student affairs and in student activities. So I'm very excited to be at Temple now. It is my alma mater. I graduated 2 times from Temple University, so I'm honored to be able to impact students in the way I've been impacted.
Thank you so much, and thank you for playing such a unique and important role in the upcoming conference by identifying diverse entertainment options.
Yes.
That's going to include acts to appeal to younger audiences. Can you just take a quick minute to tell us a little bit more about that? We did want to make an important, and I don't know if you have a cell phone. We all got a little blast on our phones about an important announcement that I want to make sure we have time to tell our audience about.
Absolutely, yes. So we are inviting a little over 5 different student organizations, honorable mentions to our outlets, so the Temple University Majorette team. We have our K-pop team. We have a Caribbean dance team coming out. We have a few local Caribbean queens that will be attending and performing inside during the festival as well. So I'm really excited for the diverse group that we have and all that they're going to be able to bring to the participants and the attendees of the festival.
Awesome. Thank you so much. And I just want to take a half a second to make sure we make our audience aware that you may have gotten an advisory. I got one on my phone, I think just as we were coming on, for all residents to drink bottled water until further notice due to a spill in the Delaware River. So there is a concern about, the safety of the tap water. So we're on a bottled water advisory until further notice. So I think that brings us to the end of the show. The producer of this show is Community Hero Action Group, which is a 501c3 nonprofit dedicated to closing gaps in health and wealth disparities in the Black community. If you want to get involved with the work that Community Hero Action Group does, such as this radio show or many other health-related initiatives, visit communityheropa.org or email at contactus@communityheropa.org. It takes all of us to get the work done. On behalf of Her Health Matters, I want to thank WURD's technical producer. We have Ms. Rhonda today, Her Health Matters executive producer, Nicole Keels-Magruder, who's also the founding executive director of Community Hero Action Group. That takes care of this episode of Her Health Matters with Dr. Sophia Shabazz. I'm signing off. Until next time, be healthy, be you, because your health matters. Take care.
Her health matters. Yeah. Our focus is her health.